Malnutrition is a major public health problem throughout the developing world, and it's an underlying factor in over 50% of the 10 to 11 million children dying before 5 years of age.
The malnutrition at times can actually start from while the baby is in the mother's womb. And that is because if the mother who is pregnant is not being fed adequately, that lack of adequate nutrition during pregnancy is also translated into the baby she is carrying even before delivery.
Globally, it contributes to nearly half of all child deaths. That's more than 3 million children each year.
When you're doing the homegrown school feeding, if you give children pap and rice, you haven't helped them. You need to give them beans, you need to give them wara, you need to give them crayfish, you need to give them periwinkles, you need to give them kuningeda, you need to give them all the fantastic foods we have in Nigeria. And we do have a lot of them that are nutritious and that are helping in that.
But then government and others are not providing adequate attention in terms of funding, in terms of providing the required support to actually address the condition. For example, even at the national level, what is supposed to be used in treating severe acute malnutrition, which is ready-to-use therapeutic food, is not included in the national health package. That means excluding 2.5 million children from benefiting from a package that should be of benefit to this group of children.
Exclusive breastfeeding rates have not improved significantly over the past decade, with only 25% of infants being exclusively breastfed during their first 6 months of life.
Now, after breastfeeding, the next form of food the child is exposed to is what we call the complementary diet. This has to do with continued breastfeeding, with introducing those semi-solid food the child should take.
So if a child is not introduced to good, adequate complementary feeding around that time, that can also later translate into a deficit in terms of growth and development.
If you talk physically, the child is getting wasted, meaning that you're losing weight, you start looking very scrawny and thin. So physically it has that impact, and that also has its psychological effects. You don't look good.
And also in their mental cognitive capacity abilities also reduce. And that means their long-term life will be affected, if they are not properly treated.
This patient is actually a 3-year-old girl. She developed malnutrition about 3 weeks before presentation. However, before then, she had suffered CNS infection, meningitis, which led to poor feeding, and she subsequently developed pictures of malnutrition. When she came, she had complications with bronchopneumonia, that's infections of the chest, and she had body swelling, which is edema, one of the signs that tells us she has severe acute malnutrition. Now, when she came initially, we started her on treatment for the bronchopneumonia, and then we controlled the convulsion that she came with. We then gave her F75 initially until she had the edema resolved within 3 days of admission. Now, following improvement with the F75, we changed her to F100, which we can see that she's tolerating. Now, the difference between this and what we do before, the availability of some of these therapeutic feed is that before now, the edema will take up to 5 to 7 days before it resolves. But with the F75, edema resolves within 3 days.
The UNICEF 2015 report says Nigeria has the second highest burden of stunted children in the world, with a national prevalence rate of 43% of children under 5, translating into 16.5 million children. With malnutrition rates currently declining at an annual average rate of just 3.1%, Nigeria is not on track to achieve the SDG goal of the 40% reduction of stunting by 2025, for which the rate of decline must increase to 5.5%. Nigeria's rates of severe acute malnutrition are among the highest in the world, at around 1.9 million children each year. Community-based management of acute malnutrition, a proven intervention for treating SAM, has been launched in 11 northern states of Nigeria. But the treatment is estimated to cover only 15 to 25% of the national burden of SAM each year.
But then to treat a child with severe acute malnutrition using ready-to-use therapeutic food costs just 22,500 naira. Is that too expensive? And then for a child with severe emergency condition will cost about 35,000 naira. Is that too severe? And even if you take all the children that are available, multiply that, you will find out that it's just a drop in the ocean in terms of what funds are available.
Now, the community-based treatments are actually meant for those who may not have complication, but they have severe acute malnutrition. They have SAM. Majority of those children that have SAM are treated in the community. Now, the question we ask ourselves, what do we use in treating them in the community? Is it ready-to-use therapeutic food?
With the intervention of RETF, some of them have been managed since the establishment of SIMAM in Wali Area Council. We have about 34 cases being, managed and recovered.
Another effective method of combating SAM is the Outpatient Therapeutic Program (OTP). Treatment for children with complications is provided by inpatient management in stabilization centers as the need arises.
To be fat, in 1 week, 2 weeks, my child changed. Let me just cut it short. Now, my child can start walking. He's feeding well. Normally before, we don't used to sleep, be crying, shouting. We don't know what is the problem. But now, my child can sleep well, he eat well, and he start moving. I appreciate God.
Beyond the politics, or even the economics of it, governments at all levels in Nigeria owe it to the people to step in and remedy the situation in such a way that will improve the mortality rates from severe acute malnutrition nationwide, especially given the massive social cultural values attached to human lives in Africa's most populous nation.
So for us as a nation, the question of severe acute malnutrition and how child nutrition comes up is a decision. It's not a decision about children. It's a political decision. It's a social decision. It's a decision about what our leaders are saying they want the future of Nigeria to be. Actually feeding your children well and make sure they don't have severe acute malnutrition is not, you're not doing a favor to the children. You're actually doing a life insurance for yourself.